Okay, we're going.
Thank you. Greetings, everyone. Thank you so much for being here. And my name is Carrie Hopkins Isles. I'm the Deputy Director for ICU DDR. And my colleague Olivia Woodrow is here to assist. And we'll be checking the chat for any questions or if there's a hand raised or anything that you need from us, we'll be able to assist. We are really excited for this topic today and for our presenter. And I do have a slide here. You'll see if you have questions for me, you can contact me at Iles, EYLESC at ICUDDR. And if your university is not a member yet, please check us out at icuddr.org about us / join us. And or you can just play around on the website and you'll find it or contact me. But in the meantime, I want to give all of the time to our wonderful speaker, Dr. Diana, and I will be here if anyone needs anything.
Thank you, Carrie. So I guess we can go to the first slide of the presentation. Thank you. So morning or afternoon or evening, depending on where you are. It's the morning here in Maryland, just outside DC, where I'm located, DC, United States. This talk is going to be focused on what's called the Strategic Prevention Framework. And I'm only staying on this slide for a couple of minutes to tell you two things. One, I don't know what it's like in other countries or other settings, but the American government loves to use acronyms. And I am apologizing in advance because you will hear me use them, but if I didn't use them, the presentation would need twice as much time because saying these things multiple times really takes a long time. So I'm going to spell some things out right here and tell you a little bit about what my relationship to them was. But most of what I'm going to say about my role with regard to this, I'm going to incorporate into the presentation as opposed to giving you a long bio now. So the title, SAMHSA, is the Substance Abuse and Mental Health Services Administration. Almost any time you see SA capitalized, it's referring to substance abuse in this agency, and MH for mental health. CSAP is the Center for Substance Abuse Prevention within SAMHSA, which oversees prevention services, mostly funding and oversight of grant activity. The Strategic Prevention Framework, which you'll hear perhaps more about than you want to, is often abbreviated SPF. The State Incentive Grant, you'll hear me say, is a grant program, a funding initiative from SAMHSA, CSAP, that we abbreviate as SIG. And so you'll hear me say SPIF-SIG from time to time. And you'll understand why we're talking about that. I have worked at SAMHSA and CSAP, and I've also worked at NIH. And again, you'll hear more about that as we talk through it. But that's what you see in the title information below about me, including my email address, which you are more than welcome to use. The reason you don't see a government address is I retired a few years ago, and I've still consulted back from time to time, but that's my personal email. All right, next slide, please. And you'll also notice that with each slide, I probably won't read through very much because I don't like reading slides, but I want to mention a few goals for this. One is, the most important one is to help you think about possible uses of the SPF, Strategic Prevention Framework, whether you're at a university and teaching students about prevention and prevention science, or you are a practitioner who wants to consider a model that could be useful in how you either utilize grant funds or work with your community, whatever your service population is. The other key thing here on this slide is that the SPF, you'll hear, is a data-driven planning and implementation tool. So for me, it was extremely useful because my background is in research. And so the notion that you're using data to drive planning and implementation, I think, is pretty critical. As for the way this will be laid out, I'm going to have a couple of slides just talking generally about prevention, substance abuse prevention specifically, a couple of slides talking about prevention science, and I think you'll understand why. And then we'll move into what the Strategic Prevention Framework is all about, and then why funding this state incentive grant is a good way of understanding SPIF and actually was served as a test of it. Next slide, please. So prevention is probably a familiar concept to you, and it's the thing I love. I've lived my life in a prevention mode, although I've done all sorts of things to my body I shouldn't have. But um, the thing about it is it's not only understandable, it's a political tool. It's something that you'll hear people say all the time as a focus of what they do. But not many people utilize it in a way that its effects can be realized. So if it's working well, and the way it's often thought about in the prevention community is you have multiple domains of influence. The individual, how can we affect individuals? How can we affect their peer groups? How can we affect their families? How can we affect their school settings and their larger social context? So prevention tries to take into consideration all of those things you see in the bullets below to promote a healthier quality of life for people. Next slide, please. And I like this quote as a specific way to think about prevention in regard to substance abuse. The goal is to prevent the initiation of drug use and the escalation to addiction in those who've already started using. The reason this matters is prevention and prevention science tend to cut across multiple levels. They used to call it primary, secondary, tertiary prevention. They use an Institute of Medicine model now, which uses different language. But the most important thing about prevention is if you can get to people early, if you can prevent the initiation of drug use. If you can't, then you certainly want to prevent abuse. And initiation is important for one primary reason. A lot of research has shown that the younger you can reach people and keep them from starting any kind of drug use, and that includes alcohol, the less likely they are to develop problems later in life. They may still use at some point, but they're not likely to become addicts. They're not likely to become problem users. So that's why I like this quote. Next slide, please. So what's the goal specific with regard to substance abuse prevention? And I will point out that this slide is really designed to lay out why the Strategic Prevention Framework State Incentive Grant initiative is the focus here. Looking not in the order that the slides appear, I mean the bullets appear on the slide, I'll just mention that if you think of it from a top-down perspective, the second bullet, the federal government and other state governments, their goal is to provide systems to help communities to address their substance use issues. The reason that's top-down, the reason that starts at the top is because the federal government provides the majority of the funding for this. There are private foundations and other groups that try to assist, but typically the federal government funds a state, and then a state funds the local communities. But you'll notice that the first bullet says the problem is local, experienced by individuals living in communities. So it's top down, but if the federal government gives money and nothing happens, nothing has been achieved. So the federal government tends to play a more hands-off approach to this once the money is distributed. And then it's the hope that states and communities figure out ways to either create prevention plans or implement prevention strategies that are going to be effective in addressing the issue. Next slide, please. So a component of prevention that is that underlies prevention science, what I was calling prevention science. Prevention science is exactly what it sounds like, the science of studying prevention, of trying to determine what works and what doesn't work in prevention. Calling it outcome-based is to say that the focus is on what the outcome you're trying to achieve is. So effective prevention is grounded in an understanding of alcohol, tobacco, and other drug consumption and consequence patterns. You'll see something more about this later, not a lot, but it's not only whether younger people, young adults, and others are using drugs, it's what are the consequences of that use. So prevention scientists will study use patterns. They'll study age of first use for the initiation concept, but they'll also look at drunk driving, accidents associated with drunk driving, drugged driving, increasingly an issue because marijuana is legal in a lot of places, although marijuana use and driving usually means you go slowly rather than too fast and too dangerously, but I'm not suggesting it's a good idea. So outcomes-based prevention is looking at that and is looking to document the extent to which those patterns help you determine what sorts of strategies might help. So in a sense, you're starting from the end. Next slide, please. This is a nice and very simple model for understanding outcomes-based prevention. You've got some sort of a strategy, a funding strategy or something else that tells you what you're going to implement. And again, you'll see that the strategic prevention framework is aimed at that. You implement these things, and then you study what happens. Ultimately, you want to know that substance use patterns and the related consequences, related problems are improving, they're going down. But there's a lot of things in between that you have to know in order to know that you're having that impact. Prevention science is, in my view, the most challenging of science formats, because what you have to be able to show is not only that something didn't happen, but that it likely would have happened if you hadn't intervened in some way. And one of the best ways, one of the best models for this, sometimes called the social development strategy, but has taken on many other life forms across different groups, is what's in the middle box, what in scientific terms you call the intervening variables, those that intervene between what you implement and the ultimate outcomes you're trying to achieve, and whether in fact you're having an impact on those. Usually the social development strategy I mentioned is framed in terms of what are called risk and protective factors. I'm hoping that what I'm saying isn't just secondhand knowledge to you, that it has some utility, but it is an important frame for what we're talking about. So if you can identify what puts people at risk of the third box, substance use problems and related consequences, and what protects them from that, then by implementing programs, policies, and practices that influence those risk and protective factors, you're much more likely to affect those ultimate outcomes. And there's a lot of science that shows this is true. I mentioned before these domains: individual, peer, family, school, larger social environment. You can assess risk and protection across all of those. And that's the goal of outcome-based prevention. Next slide, please. Okay, now we move to the meat of what we're here for, the strategic prevention framework. This was an initiative that began in 2004. And I'm gonna walk through the next slide in more detail, which lays out the model. But basically, it's a model that I mentioned before is data-driven, but is primarily about doing planning so that what you implement is likely to have the best impact. See, in the second bullet, it says that there are 5 steps, and that's what the next slide will show. What the strategic prevention framework is doing basically is it's taking an outcomes-based prevention approach to this problem of substance use behavior and consequences. Before we move to the next slide, I just want to mention quickly that when we say it was unveiled in 2004, the US federal government does a lot of this kind of thing. They will identify an initiative that is a way of addressing an issue that that particular agency is focused on, what it was built for. And sometimes these initiatives are based in good knowledge. Sometimes they're a little bit more political. Often they're directly associated with a particular political administration. By that I mean SAMHSA, the Substance Abuse and Mental Health Services Administration, is run by an administrator. That administrator is typically appointed by the president. So when there's a change in administration, there's a new administrator. That person may have a completely different vision from what came before. So often these are at the whims of a kind of leadership. The reason I'm mentioning it here is because this began in 2004, and there's I'll try to remember, and somebody please yell at me if I don't at the end, some evidence that this has actually continued until the present day, which is a very, very unusual thing to have happen, which suggests that people see it still as a successful way of addressing this. Okay, I'm going to spend a little bit of time now, if you move please to the next. All right, so what is the strategic prevention framework, the SPIF? I said it has 5 steps. Now, normally we think about it starting and ending somewhere, but but really it's an iterative model, and it's one where you may jump in from one step to another, and I'll give you an example of that. So you start with assessment, often referred to as needs assessment. This is the data-driven side of it. So you're going to look at whatever data might be available in your state, in your local community, that tells you something about what the drug use issues and problems are. Do you have high rates of cocaine use? Do you have a lot of young people who don't perceive risk in the use of drugs? Do you have a high degree of drug trafficking? Things like that. And there's usually data sources for that. So that's what the needs assessment, step one, doesn't say step one, but assessment we're calling step one. Step two is capacity. Based on what you've learned, what would you want to do now? Do you have people in place? Do you have resources in place to help you address what that issue or that set of issues might be? Now, that can be staff, but it can be a lot of other things. It can be technological tools. So an example of a strategy is to do what are called compliance checks or stings. So if a lot of retailers are selling tobacco to underage youth, you do a fake buy with an underage person. You don't punish them. You just see if they sell. Well, do you have the people to do that? Do you have the resources to do that? How if you're trying to determine whether drunk driving is improving, is it enforcement? Is it measurement systems that tell you how much of it is happening? That kind of thing. From those two sets of information, you move to a planning phase where you're in the case of the SPF, you're actually developing a comprehensive strategic plan. Now you'll see in what we call the SPIF SIG that this has to happen not only at the state level, but at the community level as well. And this should be a very well-informed plan because you've looked at data, you've looked at your state resources and community resources, and now you have a better sense. What would it make sense for us to do to address the problem we've identified? And then you move to implementation of it, where you're actually providing funding to local communities to try to address the problem. Finally, you study it. Now, I mentioned you can move back and forth. Well, what if after you create the plan and you fund the communities, you find out some of these communities don't have good infrastructure? Well, then you can look into going back and figuring out ways to build that. Move to the next slide, please. All right, I'm gonna skim past a couple of these because I think you got most of the information. In fact, I'm going to have you skip this completely, Olivia. Thank you. But I do want to mention quickly this notion that the strategic prevention framework is a public health approach. So the goal here isn't just to change a couple of things. It's to create change that benefits the entire population or community that you're working in. And that's one of the reasons risk and protective factors are so important. So you're looking across the lifespan and you're looking at entire state, but also community levels. Next slide, please. Okay, now the last kind of big chunk of what we're talking about today. The state incentive grant. Now, I think I mentioned that and maybe I didn't, the strategic prevention framework is the concept, okay? It's the larger initiative. In order for that to have any teeth to it, somebody has to use it, somebody has to do it. So what the federal government does in terms of funding is typically they offer two forms of funding. What's called formula block grant funding, and this is to states. This money goes to all states based on a number of characteristics, primarily population, demographics, etc. And it's a formula. It's a set amount that goes to the state. Historically, that money hasn't been monitored carefully. Just goes to the states, do the best job you can of addressing your substance use issues. It's not quite as hands-off as I just described it, but pretty close. Before I worked for the federal government, I worked in the state of Colorado, and I oversaw a number of these funded initiatives that came down from federal funds. It started with federal funds. And on the block grant side, there wasn't that much monitoring that happened. But the second form of funding they have is what's called discretionary funding. This is money that the federal government can choose how they spend, how they give it out. If you're not that familiar with the American political system, states have a lot of power. So the formula block grant is a way of ensuring that the government gives some money to states for their use. but the discretionary side allows them to make some more targeted decisions about that. And the state incentive grant is an example of that. You can move. I think you'll start showing bullets now if you click. Thank you. So the specific goal of the state incentive grant was to give states funding that they would then distribute to communities specifically to implement the strategic prevention framework, hopefully generating positive outcomes. There's one more bullet, I believe, on here, Olivia. And okay, I already said that. You can move. Okay, so what are the goals? Now, it's important to note that the SIG, the state incentive grant, so anytime you say SIG, think about the grant funding side of this, was aligned with the larger goals that we just talked about with the SPF. So to prevent the onset and reduce progression of use and abuse and outcomes. To do that ideally at the state and the community level. And as importantly, and I would suggest to you that this was actually a more primary goal. The goal that matters is that you're affecting the behavior. But the real goal of the SPF is to change the way states and communities do what they do. Building prevention capacity and infrastructure is critical to that. You can move to the next slide. So with that in mind, how did it actually play out? I say I'm using past tense because the SPIF SIG was a somewhat short term. I mean, it wasn't a few years. It was like six to 8 years, I believe, of funding of states as well as U.S. jurisdictions such as Indian tribe, Native American tribe areas, Pacific and Atlantic jurisdictions. But the goal was to fund everybody over time. But once that funding ran out, well, I'll explain what the goal was once the funding ran out. But the way this worked, besides using the SPF, was to provide funds to the states. So the federal government gave fixed grant amounts to the states. This was not formulaic. And the state managed the entire project. They used 15% of their funds for their own strategic planning, those steps of the first 3 steps of the SPF we were talking about, but primarily step 3, to develop a strategic plan that would be used by communities to determine how they would identify specific problem areas and what strategies they might implement to address those. Critical component of this was that, unlike almost every other grant program, almost all of the money went to the communities. So it's a really important recognition, because if you don't give the communities the money to do the work, to provide the service, how are you ever going to address those problems? The state's not going to solve them. So this funding distribution was really important. And both at the state and community level, they were required to go through this 5-step plan. The community level efforts, second really critical thing about this, they were required not just to implement service approaches to address the problems, but they had to use programs, policies, and practices that had a basis in scientific evidence. There's a long history of things being implemented because they were either convenient, cheap, or free. Now, a lot of them are good. DARE, for example, I'm going to assume most of you know what DARE is. It doesn't have a negative influence for the most part on people and communities, but it doesn't have a strong scientific basis behind it for changing behavior. This is the kind of program that should affect youth attitudes as well as their perceptions of risk. But there are a lot of other programs that really have been seriously, carefully tested. And so the idea here was that you had to draw on those kinds of things. Okay, you can move to the next slide. And I'm going to show you 2 maps, and we're not going to talk through them. This, you see how it says cohorts 1 and 2. I mentioned over a however many year period, the goal was to fund all of the states and territories. In the first 2 cohorts, which was the lion's share, they funded half of the states. These were only states that were funded in the first 2, no other jurisdictions. I'm sorry, I lied. There were two Pacific jurisdictions, Guam and Palau, but 24 states. The SPIF-SIG, in addition to providing funding to states and communities, also funded a national evaluation, which we're going to talk about next. The national evaluation I'll talk about is specific to these first two cohorts. But just to give you an idea of the bigger picture, you can go to the next slide now. I'm saying Olivia. I don't know if it's Olivia or Carrie who's doing it, but whoever it is, thank you. This just gives you an idea that by 2007, 42 sites had been funded. And you'll notice in the black boxes, hopefully you can see those okay, those are Native American entities. So the goal of spreading beyond just the United States was taken seriously as we move through. Okay, you can move to the next one, please. Okay, so how did this actually play out? The funds that went to the state went to the governor of the state. The governor then made decisions based on interactions with whoever his or her top decision makers were across all state agencies, how the money was going to be utilized. But most typically, it went to the state agency that oversaw substance abuse and abuse efforts. There's usually one agency that's assigned to. Often, just as in the case of the federal government, that might be an agency that does other things like mental health services. But there's still a component of that agency that is focused on substance abuse. And that usually is called a single state authority. So they were the ones with the ultimate responsibility for this. Their job was to create both a cross-agency working group, a larger advisory body, and then subgroups, work groups that would focus on the areas of the SPF. So, for example, the state would have, but so would communities, what are called epidemiological work groups. These work groups would gather all the data available to determine what the issues were. The state would then feed that information down to the communities, and the communities could look at additional data they might have. So that's the way it played out. I won't go into more detail here. Next slide, please. Okay, and then, as I mentioned, the goal was to provide funds at 85% to the communities and have the communities target the areas. So let's say that the state finds that the biggest issue they have is opioid addiction. Well, is that going to be true across all of the communities that are funded? Not necessarily. And how the states distributed the funds varied greatly. Sometimes they just gave something to all communities. Sometimes they targeted communities where that problem was greatest. Other times they identified multiple problem areas, and then they targeted communities that addressed the different problem areas. So if the communities had additional data, it gave them some ownership and power over what problems they addressed and how they addressed those problems. But the point was the strategic plan from the state had to target the funds towards those areas, both the problem areas and the geographic areas where it could be addressed. That was a way that it was believed you could actually affect state trends, and hopefully affecting state trends would affect national trends as well. When I say affect, I'm always assuming in a positive way. Next slide, please. Okay, I'm going to talk through this one a little bit because a lot of times what you find is that there's attention being paid to critical issues, but not a lot in the way of addressing them. So cultural competence is something you hear about all the time. Sustainability is something you hear about all the time. And you can see a lot of standard language eliminating service and participation disparities across groups, improving not just the effectiveness, but the way the programs, policies, and practices, in fact, do address those targeted populations, because very often the studies that are done are not done on subpopulations in that way. But also allowing some flexibility for how you design and implement the programs so that they can address those groups. The last bullet, to create a plan for sustaining effective and culturally competent programs. The goal of SPIF was actually to create a sustainability model for everything. If this worked, you wanted them to find ways to keep doing it, because eventually federal money runs out. The reason I wanted to spend a couple of minutes on this one is because it's something that is often paid good lip service to, but there aren't specific practical ways to address or measure them. And I would argue that happened in this case, not because anybody was trying not to do well, but I'll show you what's the closest thing we have to outcome data for these two areas at the very end. Next slide, please. Okay, so then as I mentioned, and this is where the rest of the slides will speak to this, what we learned from the national evaluation. First was to show that it had the potential to change outcomes. Second, to enhance the process by which states and communities identify and select evidence-based interventions. There are two things going on here. One is the primary purpose of it was to determine how this 5-step SPF was implemented and whether it had an impact at multiple levels, not just on the core, the driving outcomes, but on things like infrastructure and changes in ways states engage in process to do this. And so the second one was to determine whether the states and communities actually knew how to find evidence-based interventions and implement those. Move to the next slide, please. So I've sort of said this already. I think we can skip past this one. Okay, I'm not going to, this for obvious reasons, I'm not going to talk in depth about this, but this logic model, and by the way, the strategic prevention framework is in essence a logic model too, shows the way the evaluation tried to determine what had changed. So starting from the right, epidemiological outcomes, those are the things we talked about, the substance use, the consequences, etc. A lot of stuff going on in between. But in particular, if we move to the far left now of the slide, you see planning and implementation in that kind of big rectangular box to the left of SPIF money in selected states. That's because the goal wasn't just to change the outcomes, but to change the ways in which states and communities try to get to those outcomes. And what they're calling systems change, the next box in that model, would be evidence that in fact things had changed. Now, this all starts from the assumption that implementing the SPF is going to have positive effects. But even if it isn't, even if we not going to say that, even if we don't know, if it's hard to know if it does, to do better planning, to do better selection of the kinds of strategies that are likely to have an impact is still a very good idea. And if implemented widely, the likelihood of impact is that much greater. Okay, so the two levels here are meant to show state and community, but I won't go into any more depth in this because it's a research model and it's kind of hard to keep your eyes on. So next slide, please. And we're going to skip the next one, which is measurement areas. You can skip right past this one. Thank you. Okay, so what did the SPIF SIG national evaluation? Oh, you were good where you were. Step one. Can we go back one slide? Okay, thank you. What did the national evaluation learn about the needs assessment step? Okay. The second bullet, over 3/4 of the coalition partners, what they called the funded communities varied by state, but coalition partners was the generic term that was used. And largely because they often were what are called community coalitions. Community coalition is typically a group of people in the community who have some access to resources and influence over how local money gets spent. So they're people who can help make sure things happen the way you want them to based on the information provided through the SPIF process. Over 3/4 of them assessed 5 or more types of needs or resources. So this is good and bad. This means that they really took it seriously and they tried to determine what needed to be addressed out there and what resources were available. The potential bad is, can you really address all of those things? Okay, the kinds of needs and resources that were most frequently included were partnerships that existed, the epidemiological data such as substance use rate, the risk and protective factors that might cause or lead to substance use, and the consequences. Next slide, please. I'm going to be moving somewhat quickly, partly so there's an opportunity for some questions, but also because hopefully the model makes sense now that when we're talking about the data, it can Also makes sense. So let's move to step 2, which is the next slide. Thank you. Capacity building activities. So I mentioned the core goal of this is to make sure that the states and communities are actually ready to deliver whatever needs to be delivered. 97% of the partners conducted some sort of organizational or coalition capacity building activities. They actually sought to build capacity in areas that they needed it. I would suggest to you that things like hiring staff and some other things that often happen in communities are about as far as you go. This notion that you're actually looking to build capacity, I do believe was something new that emerged from the SPF. And like I said before, hard to know exactly how it ties to ultimate outcomes, but still a very, very good thing to be doing. So most commonly, they identified organizational activities and goals, and that would include things that are currently going on in the communities. They had very, very specific targeted training for staff. So for example, if these communities are now going to be implementing evidence-based programming, do they know how to do it? Do they have the expertise in-house? And the fact that there was a coalition leader may not seem that important, but somebody had to assume responsibility for this. Okay. You can skip. You can move now to the next slide. I don't know if it's changing on your screen. I'm not seeing the
No, it
change.
hasn't yet.
Okay.
Olivia? Oh, there we go.
Sorry,
Okay, great. Thank you.
Sorry, I am moving the slides. I think there's just a delay. Apologies.
Okay, nope. Yeah, I figured that was probably what's happening. I didn't know if other people are seeing them and not me, because I keep talking, but I want to make sure everybody's seeing what I'm talking about. So I'm not going to spend any time on this. I just want to mention one thing. So they all did what they were required, submitted strategic plans, and they included these sorts of things. Notice bullets 2 and 3 under strategic plan. 62% of them specifically incorporated information about cultural competence, 59% about sustainability. Does that mean they had a good plan for addressing those? Does that mean they actually did? We don't really know. But again, I'll come back to that at the very end, but we can move to the next couple of slides actually show some things about what they learned as part of this step. Step 3, remember, was where the plan for implementation is developed. So it's really critical. So what types of local community groups were funded? All right. Sometimes it might actually be a local government agency, a county or town or municipal group, because they can affect what's happening. A healthcare facility, if you can involve local hospitals and clinics, your opportunity for impact is great because they're dealing directly with patients or people with needs and issues. Next slide. Next one is going to show the types of partnerships, since that was a big focus of this, that they actually, partnership groups, they actually engaged. Law enforcement agencies, you're trying to affect illegal driving patterns. Schools are critical, not only because of the influence they have on young people, but that's where the surveys get done. If you're trying to assess whether change happens, you have to have their engagement. The media, what do you think of when you think of media? You think of these big commercials that probably don't have much of an impact, but there's a lot of local media. Recently had an election in this country, and it's really the local targeted media efforts that have the influence, not the ones everybody sees on their national TV station. Anyway, you can see this really runs the gamut of the types of organizations they try to include. Next slide, please. There's one more graph coming up. That is the last one in this. Oh, not a graph, sorry. I'm not going to talk in depth. You can read the bullets and percentages yourself. But the point that most of them had access to data systems within their communities that spoke to prevention. Now, it might be a school-based survey, which addresses risk and protective factors and use. A lot of young people, if you ask them questions, they'll tell you the truth. Have you used in the past 30 days? Okay. Almost 2/3 had a specific plan about prevention. Okay? These are the sorts of things that were incorporated into their plan. You can move to the next slide. I believe the next one will be step 4. Good, it is. So what I want to point out about this one is over time, the reason you see reporting periods is because every 6 months, They were reporting what they had done. Step 4, remember, is the actual implementation of the plan. So they've identified problem areas, they've funded communities, and now those communities, after their internal planning, gathering additional data, building capacity if they need to, have to implement the interventions. They actually have to put the programs into place. Okay? And you see here that over time, and this is still not all. The reason it's staggered is because depending on when the state started or when the state funded the community so the communities could start, they may not have been in a position yet to implement interventions. But over 1,300 implemented by the end of the third reporting period, which was not the end of the project. There were quite a few more than that. It was well into the thousands that were implemented in the end. Okay, you can go to the next slide. And this shows some of the areas that they were implementing the interventions. I'm gonna focus on, we can talk more about these things if we need to and there's time, but I want to focus on the fact that the biggest chunk of this is environmental. So I mentioned the example of stings, where you have a I forget what it's called, but it's somebody who's not really looking to buy tobacco, drugs, or well, drugs no, but alcohol. It could be drugs, could be over-the-counter drugs or prescription drugs. Who's not allowed to, not of age. That type of sting, also called a compliance check, is an environmental strategy. And there are a number of others. I personally was surprised by this. Most people like to implement things where they're hands-on and they're using a model that is oriented towards skills building, like a life skills training program. I was surprised, but it makes sense in the big picture, because what it should mean is that they saw that the influence could be greater by implementing a range of these strategies that address the larger environment. So if you think about individual, peer, family, school environment, I wouldn't have my background's in sociology. I love it that they're doing environmental strategies, but I wouldn't have expected it. Next slide. Okay, we're getting close. The pattern, the primary outcomes that they targeted, you see in the bar chart here. Right? The biggest being underage alcohol use, which is the biggest thing to address. It's the easiest thing for young people to do, get alcohol. Sometimes their parents give it to them. Sometimes they host parties because they say it's safer if they do it at home. I know this is cross-culturally a very different sort of thing. My family's Italian, and drinking has a very different meaning, and they don't have as big a problem, but it's not unusual for younger people to be drinking beer and to say it's only beer, it's not a big problem. Whether that's true or not, I'm not going to get into, but there are cultural differences. But in this country, in the US, this is a really, really big issue. So that target could be due to a couple of things. One, it's where the impact's likely to be greatest, but also where you have the most opportunity to have influence. I mean, where you have the most strategies available to you to exert that influence. Next slide. I'm going to just show you a few more outcome focus areas, and then we'll have one slide which talks a little bit about some of the actual outcomes. On the consequence side, more than 3/4 address consequences associated with use. And the two primary ones you see below are when use becomes a problem, when it becomes dependence or abuse, and motor vehicle related crashes. Next slide. Okay, monitoring and evaluation. There's one reason I'm going to tell you that this is important. It's important for a lot of reasons, but there's one I'm going to tell you. Most local communities do not have access to or these resources or expertise in these areas. So most give it short shrift if they address it at all. Now, it's the 5th step of the model, so it's required. But does that mean they would do it? No guarantee of that. And yet you can see the percentages below. They actually develop plans. Now, I mentioned I would talk a little bit about my role, my historical role, which I haven't really done. But I started out as a local evaluator, not in SPIFSIG, but in other initiatives like SPIFSIG, working with community groups that didn't have the expertise to do evaluations. So they would give me what really wasn't a large amount of money, typically 5% of their budget, to develop a plan for them and then carry it out. And then I would feed the information back to them in the form of reports, but usually oral reports, because then they had to figure out what to do with this information. Is what they were implementing working or not? In most cases, this is probably what was happening here. But the fact that they had plans and they had ways to communicate findings to their stakeholders is a really, really important indicator of progress. Next slide. We're almost done. Should have at least 10 minutes, hopefully. There are so many more of these, but I'm going to just make a couple of points. I'm going to let you look at this in your leisure time to see what sorts of things appeared to change for the better. But I'm going to mention the frame around this, which is the way federal agencies typically fund these evaluations is they'll be at most a year or two out from the end of the funding period. In a case like this, where you're trying to assess whether state trends or community trends have changed, you almost always cannot know whether it's changed because the data usually lags 1 to 2 years. So at the end of the evaluation, you might know where things stood at the very end of the funding period. And at that point, they may not have actually even finished implementing the intervention. So it's really, really hard to know. But you can see a number of really good examples. I tell you this, though, because when it says 5 states, 7 states, you might think, well, out of 26, that doesn't look very good. But if you find this kind of change with such limited data potential, maybe 5 years later, you could learn a lot more, but there's no longer an evaluation to study it. Perhaps the agency continued doing stuff with this. I don't know. I had moved to the National Institute on Drug Abuse within NIH, where I was the liaison to SAMHSA for this because NIDA actually funded this evaluation. But to my knowledge, they hadn't continued doing any more study of this. So next slide, I think, is the last one. Oh, I want to quickly mention just the bottom part of this. I mentioned that cultural competence and sustainability, it's not that people aren't serious about it. Don't misunderstand what I'm saying. But how do you know you are culturally competent? Do you know it if you saw change in particular subgroups? But at a minimum, if there's something about their practices that in fact were affected by using this model, you had an impact. And you can see that 62% had some sort of a way of addressing, of incorporating cultural competence into their practices. Maybe they would have done that before, but I'm not so sure. Almost all of them had a plan for sustainability. And I can give you 2 examples of how this happened. States were required through the SPIF-SIG discretionary funding to use this model and ideally to find ways to sustain it. But the formula block grant that went to states did not have that requirement. And I know of a number of states personally, because I was in this world, that actually moved their block grant funding to using the SPF as their model for funding and planning and implementation. Another thing that happened, which was meant to be the indicator of how the sustainability of an initiative within a federal system, when there's so much change going on in the federal system, is a significant indicator, is there was a later initiative at SAMHSA focused on the opioid use problem. And that initiative also used the SPIF in how the funding was assigned to states and what states were required to do. There's actually an evaluation of that as well, and there's some results available from that. I don't have them here, but I wasn't involved in that in any way. By then I had moved on to even a different institute with NIH, but it's an interesting study that showed some very, very similar kinds of things. Okay, I believe from here, whatever's left is just a summary slide. And yeah, I'm not going to talk through this, just summarizes. And the next one, I believe, is a resource page that shows you some publications. Any of these that you can't find, I'm happy to make available to you. Or if Carrie and her staff have ways of doing it, I can share with them as well. But I'm going to stop there.
Thank you so much. What an amazing information. So I'm sure there's some questions. I will start by saying there's a question in the comments Lori Solomon said, did he cite the social development model, i.e., the work of Hawkins and Catalano, or something else?
The social development strategy I mentioned earlier, which is the risk and protective factor model, that comes from there. They developed that. It was used by a lot of others and even added to by some, but that's what the social development strategy is. Hawkins and Catalano's work.
Excellent, thank you. Just making sure I didn't miss any other questions, but if people want to raise a hand or put a question in the chat. Some people were sharing resources with one another in the chat, so we always
That's
love
good.
that.
I'd like to see that. I'd like to see those.
Yeah, it's always good. Okay, let me see if anyone has their hand up. I really appreciated a couple things, if I can, while I'm looking for questions. The comments you made about the cultural competency, because as you said, I think some people certainly just do lip service, and some people really intend to do a meaningful pass at it, but it is difficult to evaluate and know, are you meeting the mark there?
Mm-hmm.
So I appreciate that. And then the other thing, and I'm not a prevention expert, but the little bit of teaching I do about prevention to my students, I do I talk a lot about what you said, that you're preventing something from happening. So how do you know then that it didn't happen? And as a treatment person, I'm like, well, I know if you were using and now you're not using. So I guess I mostly say thank you to all of you prevention folks, because I imagine that is very challenging.
So, Carrie, on that note, I agree with you. It's easier to know in those cases. I did some evaluations of drug court, which I think is a great model.
I agree.
Notion that instead of just putting people in jail for minor drug offenses, you have them do community service, get jobs, do other things. The data are really good on that, but you don't have a lot of long-term data to tell you whether the people whose life improves in the short term, do they keep the jobs? Do they go back to the addictive problem? That kind of thing. So
That's true.
it's a problem across the board. It's more of a challenge in
Maybe I
prevention.
just fool myself into thinking, but for 6 months they didn't use, so it's okay. So
I can tell you that for the studies that I did, usually it was at least a year and a half, sometimes 2 years that
I'll take
but
it.
we couldn't just keep doing it forever. So,
So I'm going to read one comment here that I really like, and then there's a question. So no one ever held a parade of all the kids who didn't start drinking last year. Yep. Perfectly said.
it's
Yep.
a great comment.
Yep. So Terry asks, in school setting prevention programs, what indicators can be used to measure efficacy of the program?
So many of the school-based programs are designed at building life skills or greater commitment to school. And those are examples of risk factors that you can measure. You can determine whether kids feel more bonded to school or more committed. You can certainly measure whether they achieve better academically. And that does link directly to other problem behaviors. To if there's a Hawkins and Catalano we mentioned before, who laid out the social development strategy, had this wonderful chart that showed the risk and protective factors and how they connected to a range of problem behaviors. In academic achievement, if it was good, those problem behaviors pretty much went away. Life skills training, one of the first ones and one of the best known and best studied, is really about teaching kids in school settings how to pay attention to other influences in their lives. And you can study whether, in fact, kids now feel some of these things present risks to them, whether their attitudes towards use change. Very, very often kids think, it's not a big deal. I had a beer or whatever. Do they understand the potential consequences of that? In life skills training, which is an example of a school-based program, can measure whether, in fact, those attitudes and perceptions change. There's a lot of them. There's over 300, I think, of these programs. So I'm not going to try to, and I don't know them all, but I'm also not going to try to tell you about all of them. But hopefully that helps some.
Great. And then can you provide Okay, a couple things I see. So, will the recording and presentation be made available? Yes, absolutely. We always post our webinars and courses on the ICU DDR homepage after we're done. So, if you went to our homepage and saw the slider for this, if you click on that after a couple days, the recording will be there. All of our webinars and recordings live in YouTube. So you can follow on our YouTube page in ICU DDR. We'll also have the PowerPoint, so you can reach out if you'd like that. And the last thing is a question. Can you provide the details or the study you mentioned? Or maybe it's the study.
One of the things, if you're talking about the national evaluation of the SPIFSIG, which is what I assume you're referring to, one of the items in the reference page is it's not a formal publication in an academic type journal. It's the actual report that was released by the company that did this evaluation. The company is known as Westat. If you in this country, you may be aware of them. They're a very, very reputable company. And the lead on this, Rob Orwin, I think, did a fabulous job. There's two reasons that report is useful. One is all of the things I talked about as potential findings are laid out there in greater detail. So you can tease through what strategic planning meant, what it looked like, I believe they have a listing in there of what the most commonly implemented evidence-based programs were, for example. But as importantly, there's a lot of upfront information about the design of the study. So if you want to have a sense of how this played out and Rob was really good about saying, this is what we probably can know, and this is probably what we probably can't know. But the methodology that's laid out gives you an idea of how they intended to approach that.
All right, wonderful. Well, we are at the hour, and I'm seeing a lot of thank yous and appreciation for what a great presentation you did today, and I want to echo that. Thank you to the participants from around the world for joining us, and I hope everyone has a great rest of their day.
Thank you.
Thanks, everyone.